What I remember most about the staff, the doctors and the nurses in the NICU, was their support, their care, the intelligence, the procedural know-how, the knowledge that they provided. And they were very patient. They were very informative. They told me what they were doing. So I wasn't surprised. They were very upfront, and you could really tell that. And they never squashed any hope I had.
You know, Zach was very small. Besides being born extremely prematurely and a very tiny size, he had very significant breathing troubles, and he also had some really serious infections. But very sick babies can have really amazing outcomes.
Well, I think Zach's story is more and more typical. When neonatology first started back in the 60s and 70s, we didn't really have a lot of the knowledge of how to take care of these babies. And as research got better over the 80s and 90s, we were able to make better strides. Zach was born in the early 2000s, and we were kind of hitting our stride not only with technology, but also just kind of knowing what to do a little bit better. So although he was a micro-preemie, Zach obviously had a great outcome. And I think a lot of that has to do with technology. It also has to do with the team taking care of those patients, because at the NICU, it's a team approach.
A lot of us have worked together for many, many years. We know each other, we work well together, which is why our outcomes are so great. And so I've been proud to work here in this NICU because I think we do a really great job with our newborns and our families.
I was very blessed, or my family was very blessed. We were fortunate that we were here. Seeing the new design of the NICU today was very interesting. I thought that the space was very nice for the families, and the fact that I wanted to be with my son all the time, even at night. But I couldn't, because there was nowhere to sit in that small space.
Michele was an incredibly important part of our design team from a family perspective. What worked, what didn't work at our old hospital, and I think our unit speaks for itself. It's really an amazing place.
Looking at this new design of the NICU will help parents have a better experience, and the technological advances make it better for the medical staff to help these babies, so the outcomes are better.
I'd like to thank all the nurses and doctors that took care of me 20 years ago, wherever they are.